For joining us today. My name is Katelyn, and I'm the Director of Admissions here at Mercy College.
I'm Sarah Meis, and I'm an admissions counselor here at Mercy College.
And we are honored to be joined today by Dr. Kadic, and he is an alumnus of one of our programs here. We are really fortunate that he graduated from Mercy several years ago, and he now has come full circle. He is working for MercyOne as well. So I'll give him a brief little intro before we dive in. But Dr. Kadic is a 2013 graduate of our Bachelor of Science in Health Sciences program. He's joining us today to provide details about his experience as a Mercy College alumnus and now as a member of the MercyOne family. So Dr. Kadic, could you tell us more about yourself, your education beyond Mercy College, and then a little bit about where you currently work now too?
Absolutely. Thank you so much for having me. So I'm originally from Bosnia, and I grew up in Germany. Actually a refugee from Bosnia here. So I was fortunate enough to be able to seek asylum in the US. Kind of ping-ponged around the States a little bit. We initially ended up in Nebraska and then found home in Iowa, where I went to Valley High School for my senior year, and then matriculated into Mercy College and decided to do the Bachelor of Health Sciences program. I think I was one of the first in the inaugural class, and in 2009, and so decided to get my bachelor's there and continued to Arizona, where I went to Midwestern University of Arizona, and did my master's in biomedical arts, and then went to medical school at the same school. From there, I did my family medicine residency at Woodland Hills, California, at a program called Kaiser Permanente. From there, then I went into the interview trail and came back home to Mercy, where I'm a practicing family medicine physician here at Mercy Urbandale.
Wow, that's awesome. And really full circle back to Mercy, right where you started. And I love that you've really joined the legacy and your story stands out. I know that we have quite a few faculty members here who still speak highly of you to this day because you've stayed so connected in with the loop. So I think it's phenomenal that you're back. So would you be able to describe for us what a typical work day is like for you as a physician?
Sure. I guess I'll touch briefly on just general family practice and the opportunities that are within them, since there's a lot of flexibility there, and several physicians will pick and choose what they like to do and what they find most confident within their skill set. So when you start training within family medicine, you are training in doing all of medicine. So addressing multiple body systems and multiple demographics and age groups. So you'll when I was a resident, I was delivering babies. I would take care of mom and baby and take care of pediatrics, so newborns, adolescents, and children, and then see them into their adulthood. That'll include anything from head to toe medical problems as their first line of defense, so to speak, and in addition to several office-based procedures. So I used to do newborn circumcisions. I do a lot of dermatological procedures, sports medicine injections. We do a lot of different skin lesions as well. And from there, you can also continue to do women's health, whether it's the Pap screenings and different procedures that comes with that. That typically OB/GYN doctors do, but also family medicine can do that as well. Back in the day, you would also see physicians, family medicine physicians in the ER, in the operating room. All of this I did through my training. A lot of those doctors these days are in the smaller community-based hospitals. In the bigger cities, we mostly have those respective specialists in the meantime. And then through my training as well, I was a hospitalist, meaning taking care of patients in the hospital. I would also do home visits in addition to having patients at a nursing home. And so I would, after clinic, take care of my patients there. Fast forward to now, where we have a lot of doctors in those respective positions. Family medicine has become more clinic-based. So our typical office hours, whether you're starting at 7:30, 8 o'clock till 5, Monday through Friday, Some locations still do urgent care in the evenings or over the weekends, whether it's pediatric or adult-based urgent care. And so some will do that as well. I don't do urgent care in the meantime, and I'm purely hospital-based. The additional thing that I'll do as an osteopathic physician rather than an allopathic or an MD physician is I also do hands-on treatments called osteopathic manipulative treatment, which is a hybrid between kind of chiropractics and deep tissue massage, where you learn that immediately as an osteopathic medical student. Some physicians don't continue to provide those services. Myself have continued, and I'm the only one here that does it in this clinic. And so I've partnered also with the Richard Deming Cancer Center and see patients twice a month there as an alternative type of therapy, in addition to medications and injections if they see they're specialists in pain management. And so we work well together with occupational and physical therapy and acupuncture as well to kind of offer that. So my day-to-day is mostly clinic and seeing patients of various ages and medical problems.
So I'm sure every day looks a little bit different. I mean,
Very different.
Some of the same routine things that you're doing, but I'm sure vastly different patients, different situations that you encounter.
Absolutely. And that's the beauty in family medicine is you get a lot of variety. A lot of folks will think there's a lot of monotony to an extent, but also there's so much variety and flexibility in those roles. And it allows us to also be a bit of an asset depending on where there's more need. And that's one thing that I noticed mostly with my residency training is I could go help in the ER, on the hospital floor, in the ICU, and in the clinic. And so there's a lot of opportunity when it comes to family practice.
Did you just like family practice the most during clinicals, or did you just kind of choose it naturally for your hours?
Some students will know right off the bat, and it's usually based on experience, even if it's way back with family who's maybe in medicine or an experience throughout their lifetime. Some have no idea. I went in with an open mind through all of medical school. I just liked every system equally. And luckily, the last 2 years of schooling forces you to kind of experience all of those areas, and then you really hone in the area that you'd want to most likely pursue a residency training and a license in. And so I was between cardiothoracic surgery and orthopedic surgery. I literally had 7 what are called audition rotations in orthopedic surgery. Had my first rotation, realized I actually wasn't the happiest in the operating room, and always loved family medicine and had a lot of great mentors and advisors and just great experience looking back. And in my very last year, I actually did a 180 and went full family medicine and realized that's where I was most happy. And here we are.
Good.
Yeah.
Oh, that's awesome. Well, and that actually really relates to this next question that I'm going to ask you. So taking it all the way back, what ultimately made you decide that you wanted to pursue a career in medicine? And did you always know that you wanted to be a physician, or did you come to Mercy College just knowing, okay, I want to be in healthcare and we're going to at least get started here?
Yeah, I don't come from medicine at all. And so I didn't have any of those experiences. Sometimes negative experiences will mold you and maybe guide you in certain directions. I had a close friend who died from leukemia. That was kind of the setting. And additionally, my sister dealt with seizures growing up, so she was in and out of the offices as well. So I saw myself in several clinics and hospitals and always had that in the back of my mind as a potential career opportunity, but more also in terms of taking care of folks, being the leader in terms of the team. And so that initially led me to Mercy College. I knew I wanted to be in medicine, and I knew that I would just have to slowly climb the ladder and see what would best fit me and my passion. I liked that Mercy was purely health related and just focused. It wasn't just a degree in liberal arts and you kind of figure it out from there. And so it was close to home. There was a brand new program when I had started, and I wanted to see how that would grow and continue to work with an organization that has a massive network, and it's continued to grow. Clinics and specialties and hospitals all over the place in the metro and beyond. And so at that time, I continued my education at Mercy and saw that the curriculum really was robust It was going to help me. And when you compare what are the requirements for medical school and that curriculum, you can see a one-to-one translation. And so I knew I was going to be in good hands. And there's a lot of requirements when it comes to medical school applications, and I guess we'll kind of get there in a second, but you want to be part of a network as well that can help you extend and reach out to other medical professionals, whether it's nursing. And I actually got my nurse's aide certification first because I wanted to complement and pair my clinical studies, my didactic studies with clinical experience. And I ended up being a nurse's aide at Mercy Westlakes Hospital on the telemetry unit, then saw the orthopedic unit, and then my last 2 years out of 5 years was in the ICU. And so it allowed me to see so many different hospitalists, cardiologists, many different internal medicine doctors who at that time saw their patients in the hospital and are still in practice today in their clinic a couple blocks away from me here now. And so it allowed me to really work with so many modalities of medicine: physical therapists, acupunctional therapists, speech therapists, etc. And so to see that this school had multiple programs, whether you did surgical technology, ultrasound, PT assistance, etc., it really gave you the opportunity to see where your passion was. But in particular with this program, I knew I wanted to do higher level, where it was either a master's or a doctorate degree. And this kind of fit specifically perfectly with what the requirements are for matriculation in the medical school.
Oh, that's awesome. Well, and I love it when students do go and they get their CNA first. And it's not a requirement, at least currently, for our programs, for any of them. But I do think that adds such a level of compassion. And I've heard so many our students say that then it does help them later on when, they're
Absolutely.
working with CNAs in their profession, either as a nurse or as a physician, or anything else, knowing how to relate and how to communicate with some of the CNAs and the techs that they're working with.
I agree. There's some skills you cannot teach
that
purely come from experience. And bedside manner is one thing, communication is another, compassion for other folks. And to also realize that medicine is a team sport. And there are some physicians that, I'm not king, I'm not God. We're all part of a team. Everyone is equally valuable. And I depend heavily on helping me and us together take care of our patients. And more than anything, it created humility, but it was also just to see the pros and the cons of what we see in medicine. And do you have the stamina to take care of patients in their time of need? And so for me, it really allowed me to also get an appreciation for all of the other folks and ancillary staff members that really are critical to patient care. So that if my goal was to be a physician one day, I did not want to lose sight of that. And because it's really critical to what I do now.
Wow. That's such a great perspective. You currently accepting new patients?
And you will see it. The folks who've had experience they just excel in these other smaller areas that are more important to patients than what GPA you had or what score you had on an exam when it comes to actually physically taking care of them at the bedside or in your exam room. And so that is an invaluable experience.
Yeah. I think finding too, like what you like to do, because you might on being a nurse and I want to go be a nurse, and then like me go be a phlebotomist for a week and go home and be like, I don't want to be a nurse now. And then that saved me, a lot of money, but I still care about healthcare and how can I help it? But it just helps you find your avenue, because it's not just being a nurse or a physician, like you shared, of all the different programs we have. So just gaining that experience is very important.
Absolutely. And already starting with Mercy, you have several folks that can easily reach out to specific people in those departments.
Yes.
That's how I quickly got introduced to certain physicians as well. Outside of my CNA experience, having met them one-on-one, my advisor allowed me to obtain certain volunteer opportunities, shadowing opportunities, and even research opportunities, since we as a collective work together very well with the college. I take medical students here as well. I've had students shadow here as well who want to see what things are like in a day-to-day. And so the more physicians we have allowing that opportunity, I would not be here without that opportunity. And it's grown since then. When I started it was a little harder to find those folks, but looking back, I knew definitely that was a point that I was going to make, because it usually takes a collaborative, a team to help get certain folks get to this point. And I would definitely not be here without all of those essential folks.
Wow.
It's great.
That's awesome.
Yeah.
Well, and I think that's something unique that Mercy College does have an emphasis on, it particularly in the health sciences program, is that there is that emphasis on research and on observation hours and really getting a lot of exposure to all of the different realms of healthcare. But additionally, the servant learning aspect, with getting students out into the community and contributing to the area. And I think a lot of them do realize, not only the weight of their future profession, but about the role that they play and how they interact with all the other areas within healthcare, and how they can bring that compassion to their future practice as a physician, as a nurse, a sonographer, whatever they might be doing. And so that is core to all of our classes. And I'm sure they had servant leadership back when you were here too, right?
Oh, absolutely. Yes. And that's, I think, to highlight the point you're making too, is they will be in good hands. The foundation is very concrete. The curriculum is laid out really well. The network is there. There is very little in terms of questions, in terms of, will I check off these boxes to get me to the next stage? That is very well laid out at this program. And it was even so, over a decade ago when I started it. And yes, there were some learning opportunities there as well. We kind of went with it during that time as well. But from what I see looking back, hindsight being 2020, the foundation is so well set up that they really have multiple avenues to take. And really the roadmap is laid out for them. They just have to take that initiative.
Yeah. Well, and what do you feel like? I mean, I know that we've kind of touched on this already, but how do you feel like our program specifically prepared you for med school?
Yeah.
And do you feel like you walked into your later degrees or later educational programs with an advantage?
I would say so. So a lot of the requirements for medical matriculation includes very specific science courses, whether it be general chemistry, physics to organic chemistry, etc., biochem, all of those. So those are immediately integrated: physiology, pathophysiology, pharmacology, anatomy. And we have really strong faculty. And so that really translated, and the volume and the pace and the fact that, and correct me if I'm wrong here, when I was going there, it wasn't it wasn't semesters, it was quarters. And does that still hold?
We have some programs who run that way, and then we have others. So we have like a 15-week semester, and then we also have some classes that are down into 8 and 7. So it kind of varies based on the program that you're enrolled in.
And I appreciate that there's that flexibility as well. And so at my time, it was just 10-week, more volume in less time. And it really helped show its true colors of, this is the rigor. If you can handle this, trust me, you will be well on the next stage. And it did. I just had to trust the process. And when I got to my master's program, it was just more of the same, but just a little bit more volume. And then more of the same with medical school. So it really was a stepping stone with each level, because there's so much information to learn.
Right.
And it's not expected that you're going to learn all of this information all of a sudden, all at one point. But it really was to make sure that, could you funnel into the next layer and just continue to add on to your knowledge base. And absolutely, this program helped me do that successfully. And I just had to trust the process and continue with the program the way it was laid out. So the only difference being is, for me, I just took a little bit more time to do my MCATs. The reason, and I took the MCAT 3 times, so not everyone's going to get it on the first shot. And I applied twice, 2 different cycles for medical school. So this being my third language, the verbal section of the MCAT, before it had changed, was my my weak point, and I knew that, and it was an area that I had to work on. Several folks are going to have varying degrees of science-based strengths and weaknesses, verbal and the language and linguistics areas, etc. But generally, this is a well-rounded program that helps you knock off a lot of the tasks, check off a lot of these boxes, and make sure that you're as well-rounded as possible going in. And sometimes it takes a little bit more time to do that. And so I'm not an ideal case at all. I had to, my road was not straight and narrow. It kind of weaved and turned, and some folks may have that same experience. So while I did the master's program, it's not a mandatory process. You can go straight from the undergraduate program to medical school directly. And the curriculum checked off all of those boxes as well, so that you can matriculate without any issues.
Huh, that's awesome. Well, and I'm wondering if you could tell us a little bit more about the process of applying to med school. I know that a lot of the high school students in particular that we work with, I know they always have questions about not only what their bachelor's will look like, but what those next steps in the process are like, and how strenuous that is. You know, how many schools did you apply to? So can you share a little bit about that?
Yeah. There's going to be a lot of variety, depending on people's goals. Usually it starts with they're comfortable with where they are at home, and how far do I branch out? And am I willing to leave my area that I'm most comfortable with and potentially seek education elsewhere? I had to quickly get out of my shell and still experience other locations across the country. It is not uncommon that you'll go through a process where in medicine, you may go to different states and different cities to obtain your education. So 4-year bachelor's degree, starting in the 3rd year, definitely in the 4th year, you start to think about applications for your primary applications. At that time as well, you're considering taking the MCAT and completing that, having likely the majority of those classes taken and behind you, and then you continue with your prep work at that point. You apply to schools having taken the MCAT around that same time frame for a secondary application. You wait to hear back from them. So schools will go through your several applications, and they'll ask you additional questions. All of that then does require a certain amount of money to pay for those applications. So I would also recommend that while you're going through the first couple of years, that you consider whether you're taking loans or have additional help for school, that you set some money aside. Roughly, depending on how many schools you're applying to, I'd say if you're applying to around 10 to 15 schools, let's just say you probably will need between $500 and $1,000. Some folks will stick to just a couple schools. Some will go 20 and beyond. I applied to just a few initially, and things changed as I was not accepted in terms of my timeline. So once you get past the secondary applications, they call them supplementals, then you get to the interview. You do the medical school interview, and at that point, then you hear whether you've been accepted or denied, or even waitlisted at that point. And so I didn't realize, and things have changed as we're past COVID. A lot more online and virtual opportunities exist, even for medical school and residency applicants interviewing for those respective programs, because travel used to be a big thing. It took money to get a hotel, to get a vehicle, and to check other locations. And so I initially just applied to a few schools in the Midwest. So I stuck with Minnesota, down to Kansas City, Nebraska, Indiana, of course, including our Iowa schools. That then led me to pursue my master's. Since I was not accepted, I took the MCAT 3 times, as I've mentioned. And my 3rd time was during my 1-year accelerated master's program, which I use as you could do a post-bachelorette, or you can do a master's program of 1 to 2 years as a stepping stone to matriculate into medical school. So it was just more of the same. Repeat primary application, secondary application, interview process. And all of that typically starts in the fall time, and typically wraps up around April, because a lot of the programs start in August.
Yeah. Well, and you did kind of go all around the Midwest and all around the country ultimately while you were finishing out your education and then residency. Can you tell us what ultimately drew you back to Des Moines and specifically MercyOne?
So I always say that Mercy is home away from home. I was a patient in this clinic. I went to Mercy College. I worked at Mercy Westlakes, and then I came back to the very clinic that I was a patient in. And so I work with my old primary care doctor.
Wow.
He's one of my partners. So having said that, family is here. And that's a big reason for a lot of folks. I realized I loved Arizona, and I went to California as well for my residency. I just realized I was a small town Iowa kid, and the big city just wasn't for me. Some folks in their journey will realize that other places are more suited for them, whether it's climate, whether it's a research institution, whether it's more of an academic or a community-based hospital. There's also varying degrees of clinical practice once you get out there. For me, it was ultimately family. This was always home. I knew I'd come home eventually. And then in terms of the Mercy system, it was just very easy to come back.
Yeah, absolutely. Well, no, I love hearing that. And I know that before we went live, you kind of even talked about how you're still connected with some of your faculty here at the college. What would you say your current relationship with Mercy College is at this point?
It's been great, unless they feel otherwise. As far as I know, it's no, we just recently, I toured the new facility, and this was before we even talked about doing this today. So just wanted to check in with them. I've always been an advocate. I did not, outside of all of that help, I also had areas where I felt like I could have had more advisors and mentors. And so I always made it a point to give back. And so even when I was a medical student, I gave back to the master's program to help them get into medical school. When I was a resident, I mentored medical students, even as a chief resident. And I sat on those interview boards as well to make sure that I could help others who may not be the perfect candidate on paper, but they were going to make a fantastic doctor. And so I continued that, and even now take students from our local DMU to make sure that whatever I can do to at least show them or mentor them in that way. But yes, I still, Dr. Moravec was my advisor. I still stay in touch with him. Even all these years later, he still had my phone number. And I like to give back in terms of that and stay in touch with them. I've been in touch with a couple of the other friends who graduated with me. One who is at Mayo Clinic now, family doctor. One's an ER doctor in Texas. And they're doing really well as well. We've all maintained contact. That's the beauty of also social media and Facebook.
Yeah.
We have not talked in over a decade, and then we've gotten contact and congratulated each other on making it this far, and kind of reminisced on our days back at Mercy College and talking about how things have changed at the school as well. So you definitely find a family through the process, and that's one thing I'm definitely appreciative of.
Yeah, that's so cool to hear, especially knowing that, you really were part of the first pilot of the health sciences program. You were kind of
it was interesting. I'm sorry to cut you off. To walk in and Dr. Matz is like, "Hey, Mirnes," and I'm like, "It's been 13 years. You still recognize me?" That was super cool. So definitely, they definitely take a deep interest in their students and definitely want the best for them.
Yeah, absolutely.
Yeah.
I think that's what's so special here. And Sarah, being an alum of Mercy College as well, I know it's a different program. She graduated from HCA, but I know she's kind of echoed the same thing.
Yeah, it's small, and like even when I came here to do my interview for this job, I recognized and knew a lot of the women that I worked with. So you get to know those names, and then your faculty members. So I liked that because it really helped me to make those connections. Like you said, like I know who's at the hospital and I knew who I was talking to here, and it really helps me with my students to be able to help them make those connections. Like these are jobs you could have at the hospital you might not know of, or areas you can work. So Yeah, I was
No, you-
very thankful for that.
No, you highlighted probably one of the most important parts, and I don't know how I didn't think about that, but the size really does matter. That was definitely a reason also why I chose the program is the ratios were just way better. You had a lot more attention and supervision and more one-on-one time than most other schools. So you're not just 1 in 300, 400 in a class. And so it was so nice to have that, especially when you're so new and you're still figuring things out, and to have someone help guide you a lot more intimately than I think other places do.
Yeah. And with health sciences, like, there's so many tracks to it. It's not just going to be a doctor, it's to be a medical scientist, athletic trainer, like many things. And I think that's a really good part that we have, is that we can work with our students to offer those things and like learn. And like you said, then just keep going and have those references and resources available to you. So you are sure that's what you want to do with yourself.
Absolutely. And I actually, looking back, I chose my medical school, which was very similar, a reflection of Mercy, even though it's all master's and doctorate programs, but only medical programs. And so looking back, actually, I ended up in a place that was very similar to Mercy, just the next level up in terms of degrees that they offer.
Okay.
For the very same reasons,
That's awesome.
And is that Midwestern University that you're talking about? Where
Correct.
is that? Because I think when we were talking earlier, you said where it was. I'm like, oh, it's not even in the Midwest. Is it in California?
Well, there's a lot of DO schools, osteopathic medical schools, that have sisters locations.
Okay.
So Chicago has Midwestern University, which is where they started. And then there's one in Glendale, Arizona. And so the medical school is called the Arizona College of Osteopathic Medicine of Midwestern University, because Midwestern has all those other, they have a nurse practitioner program, a vet program, all of those. And so globally, then their umbrella term is Midwestern University. So everyone gets confused about that. They're like, what's Midwestern doing in Arizona? We don't get it.
Right.
But it's because there's so many schools that
makes sense.
have a sister campus. Yeah.
Okay.
Sure. Well, and Sarah, while we have the mic on you, I guess we could say, so I did want to make note for those watching that Sarah is the admissions counselor for the Bachelor of Science in Health Sciences program. And so Sarah, can you give like a little bit of a preview of the admissions process that you work with students through when they apply for this program?
Yeah, so it's kind of, I say it's more like two-part, because I think that was the difference for me when I applied here, learning the different parts of it. So we are free to apply. So you first apply, and then getting transcripts in is a very big part. And it is having the colleges request them and send them to us. And that's kind of the big first part. And once I get all of that in, and as soon as I see it, I will go through the file, make sure you have what you need, check GPAs, and then we do acceptance or not. And that kind of then moves into the next part where you're going to get admitted into the program, which is decided by Dr. Matz that we've talked about, who is the program chair. And then I work with her in getting transcripts kind of sorted out, making sure we have classes that you need. And then we move into the next part, which is getting registered, orientation, campus visit days, just to kind of learn more about what you can do. Meet your faculty and staff and things like that. So I really work with students through that program and getting through each phase that they need to get through. So a lot of calls and emails to make sure everyone's set. So,
yeah. Lots of follow-up. Sarah sends lots of emails and texts, not an overwhelming amount, but just enough to guide you along in the process so that you know what you're doing. You're confident going into the program. You have all of your questions answered, which is so important going into it. And then you do start working with Dr. Matz, the program chair, and the advisor for that program really quickly. And so you start developing those connections that we've talked about that are so important to hang on to while you're at Mercy and beyond. Really as soon as you're registering for classes, which is a really nice opportunity for our students to already have that inside perspective before they start their first week of classes. Now, before we totally close out, Dr. Kadic, I want to Kadic. Sorry. I know we went over pronunciations before we went live, and I still knew that I wouldn't do it correctly.
No problem at all.
But with that being said, I want to know, do you have any advice for Mercy College students, prospective students who are looking at applying to the health sciences program and then potentially going on and maybe even being in your shoes 10 years or so from now?
Yeah, I will say it is a long process. I will say surround yourself with those who are on a similar path, and luckily a lot of these things will be done for you. You will see that you have a strong foundation at the school. You will quickly find yourself in a similar cohort of folks with a similar path so that you can lean on each other during this process. It's okay to go explore different avenues, whether it's through volunteer, shadowing, taking additional credits or classes, even as a job opportunity, as we've mentioned, phlebotomy or CNA or being a tech. Multiple hospital locations and clinics are always willing to have folks learn and or volunteer at those locations as well. So make your experience as well-rounded as possible to find really what fits best for you. I think I could have done a bit better with utilizing my mentors and my advisors as well, because I didn't realize I don't know what I don't know. There are so many other opportunities that if I would have asked, I would have realized that there's many different chances to do various things. And I didn't realize how well connected certain folks were and how well connected the organization was to put you in touch with the right folks. That being said, I would say also look at the curriculum and with the AMA criteria when it comes to medical school applications or whatever degree you're pursuing to compare and contrast different schools. The last thing I will say is there's a big financial backing when it comes to purely for physician, okay? Having done medical school and master's and the bachelor's, there's a high degree of debt if you don't look into Pell Grants and or scholarships, etc. I definitely could have done a better job from a financial standpoint because I was just so focused on just the schooling aspect of it. Mm-hmm. At the end of the day, it's always worth it if you truly are genuine and passionate about that degree, about people, and what you look at your next 30 years being. Mm-hmm. I know it's hard to look at so many years ahead of you, but I would also lastly say just focus on each step as they come, and then walk that path rather than getting too far ahead of yourself and kind of losing in terms of what's in front of you.
Yeah, absolutely. Well, and I think you did a few things right. You know, you were working as a CNA, which I think is a huge opportunity because that's one of those positions that you can do PRN, you know, pick up some hours here and there, no matter what stage of education you're at. I'll echo what you said, filling out your FAFSA is so important, particularly if like Dr. Kadic, you end up being an Iowa resident, you could potentially qualify for Iowa tuition grant. There are some other scholarship opportunities for students who are going to a private school. And so there are some ways to help chip away at your education. MercyOne in particular does have tuition reimbursement for current employees, and then they have loan payback if you are coming to them after you've wrapped up your degree or degrees. So there are ways, particularly when you're going into healthcare, to have other individuals and entities link arms with you, help you chip away at those loans that you often inevitably do have to take out, particularly when you are you know, going after multiple degrees. I think that's kind of to be expected, but at the same time, you end up with a lot of partners to make that shovel a little bit bigger when you're digging yourself out of that debt.
And you brought up a good point, and I'm glad that you brought that up. My current nurse is a student. Her schooling is paid for.
Yeah.
And she's working with me in real time and doing online classes and workshops at Mercy College. And if it was not for this program, number one, I wouldn't have a nurse.
Yeah.
Number two, and I went a while without a nurse. And number two, she gets to immediately experience and blend both of them together, the didactics and the clinical experience all in one, which has further accelerated her knowledge and skills way beyond where she would have been if she wasn't here already. And her schooling is paid for. So I'm glad that you mentioned that. As I don't know about all of the other programs, just to echo that, there's so many opportunities where they can actually merge and probably get ahead of the normal routine roadmap, so to speak, with this program and all of its additional aspects, because they're so well connected with the other clinics and hospitals.
Yeah, absolutely. I think that does go a really long way. And like you've said a few different times throughout this interview, there really isn't the same path for every student. You know, some people do have to break it up into different parts. It sounds like your nurse is pursuing our online RN to BSN program. You know, there's a lot of different ways to approach your education, whether you start with a certificate, then to an associate, then a bachelor's, master's, doctorate, beyond. There's so many different ways to go about it, and it looks different for everyone. But I think you're a good example of someone who did start kind of at the more entry level side of healthcare and really worked his way up, which I think has so much value for all of the reasons that we've discussed, giving you the humility, the teamwork element of working on a healthcare team and treating a patient as a whole person. So
Absolutely.
yeah, I feel like we could go on and on with our conversation. And so in the future, people will be able to find you at MercyOne Grimes Clinic. Is that correct?
Correct. Yeah, we'll be relocating. Our Urban Oak Clinic is closing due to building issues, and so I'll be at the Grimes Clinic in the future.
Well, awesome. All right. Well, one more plug if you're looking for a great family physician. But also a really great model of what we call the spirit of mercy, a phenomenal student, phenomenal now physician within the Mercy Network. So thank you so much, Dr. Kadic, for meeting with us today and answering all of our questions and really inspiring our next generation of Mercy College Guardians. So thank you so much for your time today.
Yeah,
you're so welcome. Thank you so much for having me. Have a good day.
Thank you. You too.